All right, thank you. So what we're going to be covering today is conducting an interview. So let's quickly go over what we have to cover in this. So we're going to, oops, sorry about that. We're going to first talk about what an intake interview is, of course, why it's important, because the intake interview is one of the first and most important things that you're going to be doing in your counseling. What information should I be gathering? What questions should I be asking? And then how do I ask these questions? A lot of times we forget to ask that one or talk about that one. So let's get into it here. So what is an intake interview? So an intake interview, it's normally the first meeting with the client. That this is our first opportunity to kind of sit down with the client. A lot of times, depending on what organization you're working within, some information may already be collected. So if you have kind of an intake form, many times clients are asked to fill out that intake form beforehand. Other times you might be the sole person doing that, or you may be the person, especially during kind of like an internship or practicum, who's asked to maybe focus on just the intake interview. So it's also known as history taking. Many times people also consider this to be more history taking. In the counseling world, if you're doing more mental health services, a lot of times it will be talked about as history taking. So it's done really to gather information about a client to start guiding the counselor in the work to be done. So it's really, really important that you take the time and do this in a thorough way, because you are really trying to gather as much information as you can, which is really kind of going to give you the backdrop of the client. So definitely don't try to rush through this. A lot of times I've noticed, my supervision with many counselors to be, that they try to just rush through and kind of get through all of the questions as quickly as possible. Really think about the questions that you're asking. If you don't feel like you've gotten a thorough answer and you feel like you need more, make sure that you follow up and ask follow-up questions around that. So it's not intended to be therapeutic in nature. And so this isn't usually considered part of therapy. However, some clients do report that just the cathartic nature of releasing some of the things that they've been holding on to about their own history or about the presenting problem, all of those things can be cathartic in nature and might actually help the client. But really, it's not therapy yet. So if the client asks you, are we doing therapy right now? Let them know that this isn't considered therapy, that really this is to get as much information as possible about your history and you as a person so that you can do the best work possible. So why is this important? So this tells the counselor, informs the counselor about important aspects of the client's experience. So you're going to get to really hear some relevant information, understanding, well, if the client comes in and says, well, I'm very, very depressed, and so I can't get a job, I don't have the energy to get a job. You want to not just take that as face value. That's really important to start to see, well, what's behind the depression? Really, what are your support networks? Who are the people that are there for you? All of those things are important, and it comes from the interview. And so if you've got all that stuff beforehand, then you'll already go into this session a whole lot more prepared to work with the client. It also informs the client as to what they can expect from counseling. And so a lot of times with the intake interview, some organizations also do their informed consent. The informed consent process is something that we'll also talk a lot about, because this tells the client what to expect from their work with you. So combining the intake oftentimes with the informed consent is kind of a normal process, that you're doing a lot of paperwork the first time usually the client comes in, not as much therapy or actual work, depending on what setting that you're in. So what information should I be gathering? So you want to be identifying information. So this is their name, their age, their status as far as relationship status, really any presenting problems. Of course, you want to understand why they're there. So what is it that they want to get from counseling? So that's considered to be presenting problems. Past counseling or mental health experience, this is important as well. This can help guide you in the work that you do. So if somebody has gone to a counselor in the past and they go, well, I was actually really reluctant to be here today because I had a really bad experience. It's important for you to kind of follow up on that and ask them some questions about that. Oh, can you tell me a little bit more about that experience? Can you help me understand what made it such a bad experience? Questions like that can really start to give you more information about what the client is looking for and expecting out of counseling. And then also what pitfalls to kind of avoid when working with the client. Mental health history, this is really important as well, understanding what their mental health history looks like. Have there been any hospitalizations in the past? Have they had different presenting problems that they've come in for that they've actually resolved through past counseling? All of those things can be questions to ask. Developmental history, so understanding, did you meet all of your developmental milestones on a timely basis? A lot of times people, maybe will take language acquisition, that sometimes some children don't speak until 4 or 5 years old. And then all of a sudden, they're speaking in full sentences perfectly. Other children, they start off really quickly, but they might get stunted in where they're able to kind of pick more information up. Maybe they have speech or learning issues that have kind of started early on and then kind of followed them through history. That'll be really important to get. Medical and dental dental could be part of it. I usually don't ask about dental, but medical and health history is important to ask about, really making sure that they are also seeing this as kind of a holistic approach to the work that you're going to be doing, because we know all too well that our mind and our body are not separate entities, that they all work together. And so it's really important that you understand their health and medical history, because many times some of those medical issues could actually be presenting as mental health related issues. So for example, I had a client that I was working with, and of course, I went through the history and I asked her, what her medical history was. I asked her if she'd gone and had a physical recently. And she said, yes, I did. It was probably like a month ago. And so I thought, okay, well, that's pretty recent. So, having gone through a full physical, we can probably rule out any medical stuff. So we're working together, and here it is about, probably like 5-6 months into our work for depression, and we're really making no progress. And so I went back and I asked her again, and I said, hey, you mentioned that you got a full physical. Were you sure, when you mentioned that you did that, are you sure that there was no issues that came up, nothing maybe a little strange in the blood work or anything that maybe you didn't follow up on? And then she said, well, to be truthful, I actually didn't get a physical. I thought you might ask me to do that, and I didn't really want to do that. I actually haven't been to the doctor in like 5 years. And I was like, you got to do that. So please go get a physical. And so she did. She followed up. About a month later, we talked again. And it turns out she had a thyroid condition. And so here we were working from this perspective of mental health counseling. And nothing that we would have done would have cleared up her depression, because it was actually something that was connected to her body. And so it's really important, to make sure that you understand their health history and what, they may be going through, and understanding how that connection might be there. So educational history, so understanding not only just how far in school did they actually get. Were there any challenges? Were there specific areas that were more challenging? Were there specific areas that you really excelled in? Were there certain grades that you had problems in? Understanding that is important. And sometimes that can kind of lead into the social history and spiritual history. So understanding socially, kind of through that educational process, what did that look like? Also understanding their spirituality is really important too. We really recognize that there's a lot of folks who, yes, have strict religious belief systems. Other people who just consider themselves spiritual but really don't subscribe to any one belief system. And then other folks who really just kind of disconnect altogether. It's really important for us to understand that and how that plays into their history. Of course, job history is really important, really understanding what have the jobs been in the past, but also understanding, when you're at the job, what's the progression kind of look like? Are you able to hold a job? If not, what's been happening? Understanding that's important. Really understanding their family history, especially if you're doing more therapeutic work, as family history can oftentimes lead into patterns that follow them throughout kind of their lifetime. And so the more that you can understand that family history, and really if you can go back as far as possible and understand those important relationships in the individual's life, that's going to really help you as you start to understand the client, when you go into what they call case conceptualization, really understanding why the client is there and truly what are the underlying issues that they're dealing with. Cultural information, so this could be specific to a culture that maybe they're not connected to, or maybe they are connected to. So understanding cultural information oftentimes leads you back to their parents and recognizing what their cultural background looks like. And I think a lot of times we think as Americans that, we really don't have a culture. Well, we do have a culture, and it's usually passed on from generation to generation. And a lot of times that is family traditions, family values, things like that. So cultural information isn't always just talking about like a race or an ethnic background, that a lot of times we're talking about their individual or even family culture and how that relates to the broader cultural context that they find themselves within. Relationship, marital, sexual history, all of those things are really important. I know that when it comes to asking about sexual history, it can be very uncomfortable, especially the first couple times that you do it. I can tell you that as you do it and become more comfortable, the client will feel more comfortable as well. If you go into it tippy-toeing around and kind of, well, this next part, it's a little embarrassing to talk about, things like that. If you go in and just be direct and ask direct questions, usually people feel your confidence and your sense of comfort, and they'll give you answers. And sometimes they might be, well, why are you asking? And then you can let them know that sexual history, we understand that sex is a big part of being human, and it's important for us to understand your connection to sex in your own experience. If that's happening now, so on and so forth. We know that relationships also oftentimes include sex, and that is an important part of a relationship, a deeper relationship. So being able to talk about all those things are important. Understanding current relationships that they might find themselves in. Substance use, that's another big one, to make sure that you understand, are they using currently? That's a really big one, because substance use in the current context, as in your work with them today, that could really, really change the level of commitment that they have, their ability to follow through and do the work that you're asking them to do, your ability to connect with them as a client. So understanding that, but also going backward in their history and understanding how they've used it in the past. Is it just recreational, or has it been a consistent pattern where maybe they've constantly been abusing substances? And all of that will give you information. Any legal history? Did this person find themselves in prison at any time? Juvenile, when they were younger, did they get into any trouble? All of those things might be important to understand. Any military history or service? We recognize now more than ever that being a part of our military services can actually have a really, really high correlation to certain types of mental health related concerns. And so many who have been enlisted during war times and have seen combat, that really, really elevates their risk for all kinds of different things: depression, anxiety, post-traumatic stress disorder. All of those things all of a sudden really shoot up high, which comes to the next one, which is suicidal, homicidal ideation, past suicide attempts, past self-harm. Those who have seen combat, all of a sudden they get elevated in suicide alerts as well. And so we want to, ask that history for military to also understand, well, how might that link into any suicidal ideation? So recognizing suicidal ideation, I think a lot of times, this is something that you should be asking very frequently, especially if you have somebody who's depressed. If you have somebody who has already had some past suicide attempts, even more important to continuously come back to this just to check in about it. Understanding self-harm, that a lot of times, even subtle things of self-harm, many times people don't think, oh, the person, scratches their arm and kind of scratches a hole in their arm. That is technically self-harm. And so understanding around, well, what is behind that action? Is there a sense of relief that comes from it? Are they trying to, connect to their emotions by feeling pain, feeling something? All of those things could lead up to suicidal ideation. And so we know that individuals who engage in self-harm, meaning like even cutting, burning, things like that, that they have a higher risk of suicidal ideation and actual suicide attempts. And so getting that information can be really important. Any behavioral observations you might want to note, so make sure that you're watching the client, understanding that, everybody is different, of course, but, if somebody has something like a strange, a tick or something that doesn't, isn't something that you normally see, you might want to take a note. It doesn't necessarily mean anything in particular, but it might. And so noting it and making sure that you've got that there might come up later in the work that you do. Mini mental status exam. So this is really getting an understanding of where is the client right now? Are they oriented to the present time? Do they understand who they are? Do they understand where they are? Those are kind of the big three things. And then the fourth one is really understanding if they have kind of their memory intact with them. And so you'll ask specific questions. What's your name? You might ask, who's the president? You might ask them at the very beginning before you even start, I'd like you to remember these three items: penny, apple, table. And then you kind of go through asking them their full name, asking who the president is. And then, at the later point, you come back to it and say, well, remember I asked you to remember those three things. What were those three things? And if they say penny, apple, table, great. If not, you might take a note of that and say, well, we might have some memory related issues. Maybe there's some brain trauma. Maybe there's some substance use. There's a lot of things that could connect to, but understanding where they are currently. And then if they have goals in mind, awesome, let's take them down. So many times there are some very, very goal-directed clients that come in and they want to get started right away, that they're a little annoyed maybe that we're even gathering this information because they know exactly what they want to cover. And so understanding what those goals are. And then, if there is any kind of DSM diagnosis, you'll want to, understand any past history of their own diagnoses. You're probably not going to be in an environment that asks you to do any kind of diagnosing, but if you are, this might be an opportunity to kind of consult your DSM and see where they are. So what questions should you be asking? So you're going to be asking both open and closed-ended questions. And if you're not familiar with that, we'll definitely go way into detail with this. But closed-ended questions are used to gather specific information. So what's your age? What's your name? Are you married? Things that they can answer yes or no to, or give you some specific detail. Open-ended questions are a little different, right? Open-ended questions are used to get depth of information. Instead of specific information, depth of information. So you mentioned your parents are from Iraq. How do you identify with Iraqi culture and customs? So that is really an open-ended question. You're not going to just get a yes or a no. You're going to get a whole lot more there. And so you're going to use a combination of the two depending on what kind of information you're trying to ask. A lot of times you're going to go through and get initial information, and then you might ask some follow-up questions, which are probably going to be more open-ended. So in each of the previous categories, there's going to be opportunities to use both. All that long list that we just went through, there's going to be opportunities for both. So how do you ask these questions? One way is, it's nice to meet you. What brings you in today? So it's nice to meet you, so-and-so. Fill in the blank with their name. What brings you in today? Please tell me more about whatever it is that you're trying to understand. When was the last time? Fill in the blank again. This is one that maybe it kind of help you get to that point of a little bit more comfort when talking about sexual history. So please tell me about your sexual history. If they ask, what do you want to know? I'm interested in a number of partners, use of contraception, sexual orientation, any other important aspects of your sexual history that we can really help to understand what you might be here for. And, even though it doesn't sound related, it might actually be related and helpful in our work together. Might be something like that. So that is it for now. Very, very quick in a nutshell, but we will get into this a little bit more in class. When we talk about informed consent, you'll also have an opportunity to think more about how that relates to this intake interview. So, all right, thanks a lot. Take care.